One of the topics in Tuesday's presidential debate touched on private health insurance plans and the ACA marketplace, or the Affordable Care Act marketplace. Starting September 1st of 2024, short-term limited duration insurance plans, otherwise known as short-term health insurance plans, can no longer be issued in the state of Wisconsin for more than 3 months, 90 consecutive days, plus a 1 month renewal. What that means is that you are able to enroll into a short-term private health insurance plan for 3 months with the ability to have a 30-day renewal or an additional month renewal at some point within the 12 months period of having your short-term plan. It will be a new policy that is issued. Ultimately, what that means for Wisconsin consumers is that your short-term private health insurance plans will not be able to last longer than 3 months, plus the 1 month renewal. You are also unable to get a plan issued by that same insurer within that 12-month period. So not only will you no longer have the ability for a 364-day short-term health insurance plan, you're limited to that 3 month plus 1 month renewal. That renewal will be a new policy that's issued. So after that, you will have to find a different insurance company to write you a short-term health insurance plan. One of the issues with this is the fact that if something were to happen during your short-term health insurance plan, in terms of a disease diagnosis of, let's just say, God forbid, cancer, you are diagnosed with cancer during your short-term health insurance plans, effective dates, you're not going to be able to be issued a new short-term health insurance plan afterwards. So it could be January when you enroll into a short-term health insurance plan, with the idea that you will just find different plans throughout the year. You won't be able to be issued one because they're going to medically underwrite that plan afterwards. And because short-term health insurance plans are not deemed as credible coverage by the ACA marketplace or federal standards, there may not be an SEP or a special election period available to you to enroll into an ACA marketplace plan. So in 2025, as well as September 2024 through December of 2024, it is something to keep in mind with short-term health insurance plans. I don't want to see anybody get enrolled into a plan thinking that they will have coverage throughout the entire year, when in fact, if something were to happen, a pre-existing condition clause does exist in these short-term health insurance plans. So if something happens during that short-term plan, effective dates, you might not be able to get a new short-term health insurance plan renewed to you. So really, the short-term health insurance plans are now even more than ever really meant or designed for those individuals who have a small gap in coverage. That 3 month, or maybe with that extra month of renewal, just a 3 to 4 month gap in coverage between employers, or maybe you're retiring and you just need gap insurance prior to being Medicare eligible. But it is no longer a 12-month solution in the way that it used to be.